Hello, everyone, and welcome to the Housekeepers podcast. Dare I say, the cleanest hour in podcasting. We have a big announcement, just update, just for you to know, because we haven't actually put together the marketing campaign quite yet. Well, we put the marketing campaign together. We just haven't kind of pushed it out yet, but we are changing the name of the podcast. I know it's been a long time. I have had the Housekeepers podcast since 2007. Been doing it a long time, calling it the Housekeepers podcast, and we're going to change it to Talking Dirty with Ralph Peterson, which is far sexier, right?
Are you going to keep your tagline?
I am.
The cleanest hour in podcasting?
Yeah. Yep. So it's still going to be the cleanest hour in podcasting, because I still want everybody to know that it's a cleaning podcast, so because if you just leave it called Talking Dirty, it could be anything.
Fair enough.
So it's important. It's important. So just look for that. You'll be seeing that soon enough, the new logo coming out called Talking Dirty with Ralph Peterson. You won't have to subscribe to it if you've already subscribed to the Housekeepers podcast. All of that will still be the same. Anyway, my friend, Parker Lacy, how you doing, brother?
I'm doing well. How are you today?
I'm doing really great. Thank you so much for coming on and doing this with me. I'm so excited to meet you, and I'm a big fan of Trilogy and Trilogy Healthcare, right? That's who you work for?
That's right.
Yeah, great company, great group. And so when you said you wanted to be on the show, I was very excited because, guys do good work down there over in Kentucky.
That's right.
How long have you been with them?
So it'll be 3 years in August. So we're based here in Louisville. Our home office is in Louisville. But we have campuses all over the Midwest. So we're in Kentucky, Indiana, Ohio, and Michigan. And But obviously we're based here in Louisville, and so we've got a really good home office, and we enjoy our Midwest presence.
Yeah, it's really great, and that's such a great, for healthcare. It's a pretty dense area. A lot of opportunities out there. So
yep,
there's a lot of places to serve. A lot of places need us.
That's right.
I had a friend post something on LinkedIn earlier, and it was pictures of floors, like really shiny, really great floors. And he said, "This is all we can do." And I wrote, that's the best thing that we can do. I mean, you want to, do you want to know the secret sauce of giving somebody the impression that they should do business with you? Have shiny floors.
Yeah. That first impression,
building, right?
That first impression is so critical on creating, and not just, our families and residents, but also employees, right? I mean, I think we don't think about that enough, and that's something we always talk about here at Trilogy is, what are we doing to make sure that our employees are walking away from our campuses with a great experience, and they know that that's someplace that they're going to be proud to work, and that's a big part of what we think about too when we think about what are we doing from a first impression standpoint.
I like that a lot too, because yesterday I was down in North Carolina. I spoke at Leading Age, North Carolina yesterday, and one of my big, I was talking about management, talking about how to manage when nobody wants to work. And, in our industry, in senior care, let me say this. I mean, across the board, everybody's struggling with staff. And in senior care, they're struggling pretty great. But I've struggled with staff my entire career. I work in housekeeping. I've always had a problem with staffing. And so I like to take it down to that level. Like, let's talk about staffing down here at this level. And you're so right. I think that if you want to, I think the best way to handle staffing issues right now is to compete at the highest level for staff.
Yeah. And people want to be a part of a team that's successful, right? It's really hard. It's really hard to get people motivated every single day when they're coming in and they feel like there's just no way to get to the top of that mountain, right? But if you're already going in and you've got a team that's already being successful, jumping on that merry-go-round of the campus's operation and everything else that's going on and all the other things that you're struggling with at a campus on a daily basis, if you can create that environment and bring somebody new in and have them jump on that merry-go-round that's already going well, right? That's going to be your product, and your retention rate are going to be so much better than trying to bring somebody in where everything's chaotic and everyone's getting flung off. And that death spiral is really hard to correct. But once you correct it, right, you got to stay disciplined on keeping that in a virtuous cycle. And then once you can do that, you really start to compete and make really good gains. And so that's really critical. And that's a big thing that we focus on.
Yeah, agreed. I've been part of an awful lot of startup teams, and they can be a challenge
Mm-hmm.
because nobody believes you. Like, trust me, this is going to work. I'll believe it when I see it. By the way, not seeing it yet.
Right. And then everything's every day something's different, and you've got to, you're trying to adjust, and there's not unless you've got that cultural backbone that you can really kind of depend on, it's really tough in those environments.
Really can be. Speaking of backgrounds, I'd love to, if you don't mind, permit me, I'd love to go back to the beginning. Are you from Kentucky originally?
No, I'm not from Kentucky originally. Growing up, we moved around a lot. I'm originally from Dallas and still have a lot of family in Dallas, but I really grew up in Nebraska, in a small town in Nebraska, and went to the University of Nebraska for college. And so that's kind of my initial background. And I was a construction guy, and so that was really my focus. I did my undergrad in construction management, and that was really my focus.
Way too ahead of me. Wait. So what was it like growing up in Nebraska?
It was a lot of fun.
Small town, you said?
Yeah, so I graduated with 36 kids in my high school class.
Yeah, that's a small town.
Yeah, so when I tell people I graduated with 36 kids, they're kind of like, that is not the typical experience, right? So I wouldn't say it was a typical experience, but it was a lot of fun. Small, really close-knit farming community. I always joke, I moved there in 6th grade, and when I graduated, I was still the new kid. And so, it's just kind of an interesting dynamic, right? I mean, but it was a lot of fun kind of growing up there. You got a lot of space, and, people were very, very kind and very forgiving. And so it was a great place to grow up.
What brought you there? 6th grade? What?
Yeah. My dad was in the restaurant industry. And so we were in Dallas, and actually we lived in Columbus, Ohio for a little bit. And he had an opportunity to move out to Nebraska. And so off we went, and we moved to Nebraska. And it was just kind of,
So he worked, what did he do in the restaurant business? Was he a chef?
So he was, so he did operations for a number of different restaurant groups. And then he had kind of a partner that was starting a concept. And the partner was originally from a small town in Nebraska. And so he was moving back to start a steakhouse concept, kind of saloon concept back in Nebraska. And then brought my dad out to kind of run operations. And then he did that for a couple of years. And then he ended up opening his own restaurant in Nebraska. And so we ended up working at the restaurant kind of growing up. And so it was pretty neat little situation. So
my dad ran a restaurant when I was a little kid, and he didn't do it for a long time, but he did it for a little while. And the biggest memory I had, other than we got to eat, like we'd go there and he'd feed us in the back. That was kind of fun, standing up at the counter, which is really where I still eat. Drives my wife crazy. Sit at the table. I don't know.
Yeah, right.
At the counter. But I remember he was making meatloaf, big steel bowl, both hands in there making meatloaf. And I go, how come you're using your hands? And there's a full restaurant. My dad's like, shut up.
Yeah. We, growing up, we'd go in all the time, either to work, or we would just be there, because there was kind of no other place to be. But it was always nice as a teenage kid, being able to go in there and kind of order whatever I fancied, right? So
yeah,
I remember at one point I decided I wanted 2 chicken fried steaks stacked on top of each other like pancakes, and that's what I was looking for. That's right.
Are you an only child, or what? Do you have siblings?
No, I've got 2 older brothers. We're all about 18 months apart, and so we were pretty close in age growing up. So
yeah, that is really close. Good.
Yeah. So
that's super fun. What about sports? Were you guys competitive?
Yeah, so most of the time when my brothers and I stand next to each other, people won't even think that we're brothers. We're all pretty diverse in kind of our backgrounds. I played a lot of sports growing up: football, baseball, basketball, track, wrestled. Played rugby in college. Played boxed for a little bit. I'm doing triathlons right now. Trying to think. I'm sure there's a couple others I can't think of right now, but. So growing up, it was pretty much anything I could do outside, anything from a sports perspective, I was always interested in doing.
Yeah, that's really, and same with your brothers. Are you the youngest, you said? You're the youngest.
So I'm the youngest. My two other brothers are, so my middle brother is an electrical engineer by trade. And so he was always a little bit more academically inclined. And so he was a little bit more focused on that and really enjoyed that. And then my oldest brother's pretty similar. Very, two really, really smart guys, very intellectual. So it's kind of always, they're a little bit more predisposed towards that perspective of things than I was. So they always enjoyed dancing intellectual circles around me.
Yeah, I'm the youngest too, and I had two older brothers. And the reason I ask is because I literally spent like between the age of 8, maybe 7, 8 years old till I was 12 or 13, just getting beaten up by my brothers with sports. So they would just, put the football pads on me and no, we're just playing a game. The game would just be Kill Ralph,
Yeah.
Just wondering if you had that same experience.
It was no, not really. It was kind of an interesting dynamic, right? Probably by 7th grade, I was probably just as big as both my brothers.
Oh, wow.
And so by 7th grade, we kind of leveled out on that perspective and kind of just left each other alone from that. When I was younger, though, absolutely, right? I remember they used me as a battering ram, as a test subject. Anything. If they had an idea, I was the first one in the basket going down from
me too.
The top bunk. And who would have guessed the guideline tied to the back of the chair wasn't going to hold up. So just went straight to the ground.
I've got more scars, and it's just like, how did that happen? Well, my two older brothers, we had a bike without a tire on it. Like
that's right.
How does a great story start if not like that, right?
That's right.
Bike without a tire. And so your dad worked in restaurants. What'd your mom do?
So my mom was a home. She took care of us full time.
Nice.
And so that was great. 3 boys is a handful, and so
no question, especially that close.
Yeah. So, everything from running us to soccer practices, kids, and, just kind of keeping the fridge stocked and just kind of managing all that. That was more than a full-time job. And so, which was really nice to have her around and be able to take care of us. Yeah,
that's awesome. So did you say that you also worked at the restaurant? So was that your first job, was working at restaurants?
I think my first job I ever got paid for, I was probably like 6 or 7. I swept a neighbor's basement. I don't know how I ended up into that, but I just remember that was my first job was swept a neighbor's basement for, I don't know, it's probably like $5 or something like that. But that was my first job. And then I'm trying to think, I don't think it was my first job, maybe it was. There was a long period there that I was kind of, in the summer times I was working at a landscaping company, and then I'd be working at the restaurant. But it was pretty common when my dad opened his restaurant, it was pretty common for my mom to pick the three of us up after high school and drive to the restaurant, and we would work at the restaurant either when it was first getting built or right after it had been built, running the dish tank or and then in high school I was working on the line, as a line cook, and then in college working as a waiter, and so it's pretty common.
Yeah,
same for my brothers as well.
Yeah. So what did you go to college for? So you go to, all 3 of you went to college.
Yeah. So we're all 3 of us we all went to University of Nebraska in Lincoln. And so that was actually, it was about a 20-minute drive for us from the university down to the restaurant. And so we would, in college, most of us would work there in college as well.
Really? But what was your major in college?
So I studied construction management. So I was a construction management undergrad. I kind of bounced around for the first couple of years in college, but that really kind of settled. It was a good blend for me, right? I wasn't technically inclined enough to really do, what my first degree was, which was physics, which was a pretty.
That was your first choice? Yeah.
So that was a pretty wide awakening, getting into physics. But I wanted something a little bit more tactile, a little bit more real, right? I always say, a little bit more concrete. And that kind of comes out as a little bit funny, right? When you're talking about construction, but it was a good cross section for me, right? I got to do some really technical things, and I enjoyed that side of things, but I also got to be a little bit more hands-on and not so abstract. And so it was a good cross-section for me to kind of focus on. And that was something I had always thought of in college. I worked not just at the restaurant, but I also did some, continuing landscaping. And then I was doing some sprinkler irrigation work through college. And so it was just kind of something where it was a good fit, and did some road construction for a little bit. And so it's just a good fit for me, and it worked out really well. It gave me good exposure from a technical perspective, and also exposure from a human element perspective. And, those things, not everybody thinks about those two things and how they kind of blend and how they work together.
Yeah, it's kind of what I was thinking when you were saying that whole operational side of it. In my experience, management and operations is a tug of war.
Mm-hmm.
Where both are sometimes competing against each other, and in the middle somewhere is the customer.
Mm-hmm.
Am I getting what I'm supposed to be getting? Construction manager, that's pretty great.
Yeah,
that's a really great. It seems like it's a great, well-rounded thing to study.
It was, right. I mean, it gets you exposure to especially from a facility standpoint, right? It gave me exposure to essentially all the different building systems that I was going to experience, and a good foundation in those. And then from there, as I start to learn the new systems and the things that they didn't cover, you're kind of piecing those pieces together. And then as I got more into our environmental side, it even helps further, right? Because it was just kind of, you're layering all these different systems on top of each other, understanding how they all work and how they breathe together. There's not very many people that, it's fortunate because I get to understand what the HVAC system's doing and how it could affect the plumbing system, or how it could affect the system, or how it could do, so there's all these different systems that most of the time someone's an expert in just one of them. Mm-hmm. And so blending all of those has been a lot of fun for me, and it's been a big challenge, but it's been a lot of fun.
I think that it's important to just highlight what you're saying there, because one thing that is sometimes people don't realize, and I'm talking generally, I train housekeeping managers for a living, so I'm talking really specifically about housekeeping managers. One of the things that they sometimes don't realize how important it is for them to know more about the job above them or beside them. Those other learning about those other departments and what they are facing with. It's just going to make you a better housekeeping manager. Mm-hmm. It's just going to make you a better, well-rounded. You're going to be able to see how what you do affects them and how what they do affects you. And you wouldn't believe the amount of synergy that goes between every department, and especially in a healthcare environment, which is what we work in here. So it's really smart. Good way of looking at it. So how did you get into the EVS side then?
Yeah. So I kind of had a number of different jobs. And then I came from property management or property maintenance from a hotel. And
I lost you for a quick second here.
Yep, there we go. And then I had an opportunity to come here. And
so hold on, I might have missed it. So how did you end up in hotels?
So I came from I was working civil construction before there, and so it totally makes sense, right? So I went from petrochemicals to civil construction to hotel management, property management to healthcare, environmental, and facilities management.
I gotta say, of all of those leaps, the property management to EVS, that seems the easiest to make the connection.
I would say it may sound that way, but personally, right? The hardest transition for me, the hardest one to learn, has actually been the EVS side, right? Like, to really master it has been absolutely the hardest one to master.
Yeah.
And I think that's the case, right? And you have to, think about it. I started in this role in August of 19, and I was like, oh, this would be great. I'll really be able to get my feet underneath me from an environmental standpoint. March of 2020 hit, and all bets were off. It was, it was like, you have 36 hours to figure this out.
We haven't learned about contact time yet. What? Wait a minute.
That's right. And so it's funny you say that, because, like, for me on a personal level, right, and professional level, like, there's not a lot of institutional knowledge out there when it comes to our world, right? And there's you would think that there would be, you know, volumes and volumes of manuals that you could pick up and really read and go, okay, I know everything I need to know about this system. The reality is there's about 4 books that you can buy off of Amazon, right, that really detail how those things work. And out of those 4 books, like you could pick them up and read them, but it still didn't really give you a lot of the, you know, you're still dealing with a lot of some tribal knowledge of individuals, right? And you're trying to piece that all together and how to make that work in a very dynamic environment like COVID, and try to understand how do you structure systems and processes to really help from an environmental standpoint. And so, you know, I was reading everything from CDC manuals to Army field hospital manuals, trying to put stuff together, right? I mean, it's almost hard to remember, but early days of COVID was a pretty dynamic time, and we were doing everything we possibly could to figure out solutions as fast as possible.
You know, there's something interesting that a lot of times, so I'm always, you know, when I'm outreaching, and again, I have a management training company, so I'm always outreaching to people and trying to get people to just learn about what we do here. And I always what I do is I train housekeeping managers, and I can't tell you how many people try to correct me, and they're like, no, it's EVS directors. You know, we don't like housekeepers, we like EVS. And although I appreciate that, I just want you to know, and I'm always saying this to other people, I'm talking about 2 different things. EVS, environmental services, is you're typically cleaning facilities or hospitals, factories, offices, banks, completely. We in senior care, which is what I work in, we clean people's homes, and so we're cleaning housekeeping, right? And when COVID hit, so prior to COVID, housekeeping for us is always about how to provide this clean, sanitary environment without it looking like a sanitary environment.
That's right.
We don't want a senior care center to look like a, you know, white-walled hospital. It's not helpful. But then COVID hits, and now it's like we have to have the standards of the hospital.
That's right.
Implemented right now. We're like, wait, what?
Yeah, so Rob, I think you're spot on, right? And that translating those into our spaces, right, really kind of fell on my shoulders during COVID, and it was and I was very lucky, right? Like we had a great team, and we had really engaged sponsors, and we had from our chairman all the way through, right, even to frontline workers, we had a lot of buy-in on what do we need to do and how do we solve this and how do we bring those systems in and how do we implement them. And we've been very successful being able to do some things that you know, were really exciting for us, and we feel like have been a big impact. And we're going to continue to do them, because I think that dynamic, what you're talking about, that dynamic of a home environment that's being cleaned to the level of a hospital, right? That's a difficult thing to do operationally, and doing it every single day, 365 days a year, at 130 campuses is a pretty dynamic, you know, problem and challenge to solve. But we've been very fortunate in implementing our SHIELD program and bringing in a lot of great partners to kind of help with that. So it's been really exciting.
Yeah, no, I appreciate that. I think that I remember, you know, one of the first things that I did a double take on was when I did have an administrator ask me, how do I know a chemical works? And it was such a weird question, because you never think of it. Like, when does the last time you've ever washed the dishes in your house and thought, I wonder if this soap is working, right? Like, you just don't even ask that question. And I started talking about dwell time and contact time. And as I'm explaining what contact time is, the person I'm talking to turned into 2 people, turned into 3 people. Before I know, I have a crowd, and and I don't say it out loud, but I'm just thinking to myself, I've been talking about contact time and dwell time for 10 years. Nobody's cared ever. Now all of a sudden, I got pieces of paper out in a pad.
That's right.
Wait, what does it mean?
That's right. That's right. It's really funny you bring that up, because we use an ATT or ATP testing program for our surfaces. And to that point, right, one of the biggest things that we found was, you know, you clean a surface and your question is, how do you know that surface is clean? It looks clean, but how do you really know it's clean? And what we found was that as we continued to test, we would find consistently what we thought was clean had additional opportunities. And that's real. I mean, that feedback loop has been tremendously successful of being able to educate our housekeepers and saying, hey, that surface still needs some physical abrasion, right? And that dwell time and physical abrasion and the right materials, and there are so many things that go into that equation that, right, kind of going back to what I was talking about, there's not a lot of, there's some knowledge out there, but it's not as institutionalized as we would have hoped prior to COVID. And so we've had to do a lot of learning on that very quickly to kind of figure out exactly what's the right formula to use for that.
Yeah, I agree. And it's interesting. It's interesting in the sense that there are a lot of us who have for years, and not I don't think out of malice, but just the way it goes, just for years, we've always just kept our learned information through experience. We just keep it to ourselves. We've never been the most technologically using,
right.
I've not been, other than like a Facebook account, I haven't always been the most tech savvy. I've always worked in, so my knowledge, it's, you start thinking about how do you manage and I remember this was like 10 years ago, there was this big thing just about when we were talking about the baby boomers retiring. And so the question was going to be, or one of the questions was, what's going to happen to all the knowledge that's going to retire with the baby boomers? Right. And that's kind of, I think, what happened prior to, as we came into COVID, we're like, wait, where do we find all these resources? And the truth is it's in a million of these things, in these heads, but we just never,
I think to that point, I think it's
changing. I'm just saying.
I think it is too. I think it's one of those things, right? Like when you look at kind of like, you have these big movements around sustainability or your ESG. I think it really is one of those things where like there just needs to be a catalyst for that conversation to start. Mm-hmm. And then as that conversation starts, it kind of builds momentum. And I think that's kind of what's been happening in our space, especially in the last 2 years, right? Big catalyst with COVID. And I totally understand, right? People are people are tired of talking about COVID, right? I mean, that's just the reality is not everyone wants to hear about it, but it opens up a whole new conversation about, do we have to be accepting of people, coming in and Phil 3 cubicles down has got the flu, but he's still coming in, hey, we've kind of broken this mentality that you have to be in the office to work and you can work from home. Okay. Hey, Phil, you don't have to come in if you're coughing and sneezing all over the place. But then the other question is, well, maybe he hasn't coughed and sneezed, but how are we protecting the other employees in the space and making sure that they're being protected? And then for us, right, in a healthcare environment, how do we make sure our residents are being protected all the time? And there's so many different layers to that I think with coming out of COVID, and as we kind of get our feet back under, everyone gets their feet back under, it's a conversation that I think is going to continue to happen going forward. And how do we continue to elevate that game past, kind of what you're just bringing up, right? Kind of everybody's just got it appear, but not institutionally. Where do we all go for this body of knowledge, and how do we all kind of share it and know what's going on? So that is one thing that hopefully comes out of COVID is we continue that conversation and we all get better and better for it.
Yeah, I agree a lot. And I think one of the things that we've already been seeing as a result of the pandemic is just how important housekeeping not only is, but how important training is, how important education is. I mean, everybody, it doesn't matter who it is. You just ask them. Everybody thinks they can be a great housekeeper. Everybody thinks housekeeping is easy. Everybody's a floor care expert when they walk into a facility, Everybody, everybody's super easy to jump on the bandwagon, but there's a lot to it. EVS is a humongous endeavor.
I mean, to me, it's manufacturing it's really bringing in manufacturing on the floor, but you're doing it across, you're moving that production every single time. Right.
Yeah.
And that to you, exactly what you're just saying, right? That's really tough, right? When you look at Toyota or some of the really good manufacturing operations, they spend tremendous amount of time training, looking at their process and procedures, understanding step by step, where is there a catch? Where is there one place that we can have a variability that's wider than the range that we're willing to accept? And then how do we change the process to vary or bring that variability down? And so when we're thinking about that, right, you've got a housekeeper and they've got 20 rooms in front of them for the day. How are we putting that housekeeper in a position to be successful, knowing that every single one of those rooms they're going to be able to go into, be successful, do all the steps that are needed, and stay within that range of variability to make sure we're keeping that resident safe. That for us is like, that's kind of how we look at it, right? And more kind of like almost a reliability process, right? From a manufacturing perspective that we've kind of used as we kind of move forward. And it's much more complicated than I think a lot of people are willing to either admit or it takes a lot of time to get into the weeds and really understand. All right, these very specific details have to be covered and understood to make sure that we're not missing something.
And what's fun to talk about, but not so fun to address is the idea, because I've worked in all kinds of cleaning industries. So I've cleaned offices, I've cleaned banks, I've cleaned houses, stadiums, condos, hotels. The thing that's different about cleaning a nursing home or a senior care center is, number one, you're cleaning during the day with other professions working, doctors working, rehab working, dietary working. That's normally you go clean offices. Nobody's there. Nobody's ever there. I cleaned a radio station and they wouldn't even have we would go in there at night. And there wouldn't even be a DJ. It would be a recorded DJ. We always thought the DJ was there live.
Yeah.
And we go, no, nobody's there.
Yeah.
Then when you get into senior care, you're literally, and now that throws a whole wrench into it because
right,
every department has a say, the residents have a say, the weather has a say, the state has a say. There's a lot of accommodations that have to be made in order to get a floor stripped and refinished. You know what I mean?
Absolutely. Right. And it's a very dynamic environment, and kind of going back to what we were talking about before, right, is like getting that culture right is step number one. And that's something that we really believe in. And that's something we really focus on, is getting that culture of the team right from day one is the real critical key. Because once you can do that between all those different departments, everybody can be working off the same common page from a cultural standpoint. And you kind of all know, hey, here's the number one priority as we come across a problem. We're all kind of working off the same sheet of music, as opposed to having different departments kind of, hey, we think this is a priority. We think this is the priority. So setting that culture where everybody's baseline to what the expectation is super, super critical.
I think you're talking about something that's even more of a challenge, and that is, and it's true, every department has a priority list, and those priority lists are different in every department. Nobody has the same priorities.
It wouldn't it be nice if it was? But I think that, being honest and saying, look, we all understand everyone's got to be a different priority list, right? Between activities and life enrichment and our marketing team and our clinical team and our environmental and our DPO and the business office, but making sure that they're all aligned, right? I mean, making sure that they're aligned from a cultural perspective and what our company's, our expectations are from a leadership perspective that's so critical. And I think that, for me, it's been really exciting to be with this company because we execute on that so well. And it is really exciting to go to campus and see that and see them all aligned, right? Yeah, we've got different priorities, but everybody, when they're aligned, it's a pretty neat thing to see. And it's really exciting to be around something like that, because it's like, this is a pretty high level varsity executing team that is getting stuff done in a very dynamic, chaotic environment. And they're all just, they know what needs to get done and they're executing. And so that's pretty neat to see. Yeah,
I completely agree. And again, I don't know if you ever worked in a CCRC, but that kind of is what brings to mind, from a facility director point of view on a CCRC, because you might have a continuum care retirement community, for those who don't know what a CCRC is. You have independent living, which may or may not include us at all. I'm involved with CCRCs that have the people who live there, the homeowners, they hire outside house cleaners to clean. And then I have places where they have us clean it,
Yeah.
And then same with the assisted living, with the apartments. I have places where they want us to clean every week, and then I have places that clean once a month.
Mm-hmm.
Like, it's so different. It's so, it's such a, and if you get them all on the same page and they're all kind of working the way that, again, the customer wants, not how I want necessarily, but as the customer wants. I wish everybody wanted it my way, but they rarely do.
No, yeah, it's that's a tough one to find.
Yeah, no question. No question. So what was the biggest challenge for you guys during COVID? Was it just trying to understand the operation or trying to keep up? I think that's what our biggest issue was trying to keep up with the noise of it all.
And, I think of it, COVID for us was it was dynamic, right? A very dynamic environment. I can't think of one that was like, hey, this is the one struggle that we really had the entire time. I mean, it was very dynamic, right? And so as we solved one problem, we were really kind of leaning into the next one and leaning into the next one. And so that was a little bit, it was, the pace was probably, I think back to it, it's like, it was 7 days a week for a couple months.
Yeah, of course.
9-10 months, right? And during that time, we picked up PPE distribution and some PPE sourcing requirements. And so like that became very dynamic. And then you throw in there from a cleaning perspective and a chemical perspective. And we implemented a number of new technologies and processes during that time that we felt were really critical. And then you add on top of that, you've got staffing shortages and from an all perspective, right? And I think that was probably the hardest one. It was just kind of, making sure that you and your team were ready to pivot at a moment's notice, right? And so I'm very fortunate. I've got a support team that I work with that really supports the campuses on a daily level. And I was very fortunate to have a really great support team that, as we kind of moved through that, everybody was ready to twist on a dime, right? Okay, hey, today we're all doing this. Tomorrow we're all doing this. Hey, next week we've got a shift and we're all going back. And it was always something that I could depend on them to make that shift and make that turn and make that happen. But that was definitely a very high tempo environment that, we were trying to work through a number of different things. But I think now, I think from a protection, from an infection controls perspective, I think we're better today than we've ever been, right? And I think that's from a perspective, bringing in a lot of those technologies and processes that we didn't have before that were, quite frankly, there wasn't that catalyst for us to think about, hey, how do we need to take this all to the next level? And through that was really our catalyst. And we were able to bring some really neat technologies into our campuses that we really feel are going to be, game changers for us long-term, and into the future.
I completely agree. I think, if you look back, I look back on 2020 and 2021. I mean, what a fantastic time to be in a leadership position in environmental services, because they were throwing everything at us. And the answer, there was no option of, you can't do it, failure. I mean, you know what I mean? Like, it was just,
sure.
How are we going to disseminate between a COVID unit and a non-COVID unit? And by the way, what's the transition space between a COVID unit and a non-COVID unit? And what is that what can you do in that space? Like, you have a COVID, you have a non-COVID, and you have an area in between. How do you clean that? Like, what are the rules there? So like, rules for COVID's easy. Rules for non-COVID, easy.
Right.
That middle piece.
Yeah. And then you end on top of that, right? I mean, we were learning by the day, right? Sometimes by the hour. New regulation, new change. This came out. We're hearing a rumor of this report's going to come out. This one hasn't been peer reviewed. This one's been peer reviewed. We're taking this. ASHRAE says this. CDC says that. And, health departments are saying this. And so, being in that kind of dynamic environment, and then to your point, right, we're trying to do what's best operationally at the campus, and we're also trying to stay compliant from a compliance perspective, and just trying to find that middle ground and be able to make sure that we have the systems and processes in place that we could turn and do those things so quickly. Was definitely it was a challenge, but I think that we were very fortunate with the teams that we had, and we were able to execute extremely well through that time to keep up with all those different competing requirements.
Even with staffing, I mean, we've always been on I feel like anyway, we've always been on the forefront of how to recruit, because we just always are in recruiting mode. You're always trying to figure out how to get staff in the door. And through the hardship of that, through the years, I've been doing senior care for 25 years now, 24 years. The hardship of that has made us like really, really learn how to do more with less. And that really helped us.
Yeah.
During COVID.
It was, staffing 100% was a challenge through COVID. And, one of the things that we kind of looked at was how can we provide an environment that we know that employees are going to feel safe in our facilities, knowing that they're going to be working with COVID, right? And so we were able to do some things. We brought in some really great partners from 3M and some really great partners from R0. And we kind of looked at everything, holistically, and we said, how do we protect not only our residents, but also our employees at our campuses? And we ended up developing our SHIELD program, which was this multifaceted approach of how do we protect our campuses in the best possible way. And I think that was a big differentiator for us from a staffing perspective. But that staffing, is really tough. And you really you've got to have a game plan going in, right? I don't think it's like, what it was even, 10, 15 years ago of you're kind of just hoping people are going to walk through the door. You really got to have a plan for how you're going to bring those staff in, how you're going to make a connection with them on a personal level, how you're going to include them in the culture of your team, and how are you going to get them trained, and how are you going to get them bought into the why behind your team. That you got to have a really systematic plan of how you're doing that. And the great operators really do that well. And that's always really impressive to see and to watch, is when they can do that and execute on that consistently.
I was surprised. And, as the years go on here, I guess the further we get away from it, the less surprised I am about it. But I was really surprised at how many people quit healthcare because of COVID. Like, I saw nurses walk in the door, RNs, like legit nurses, went to school for it, learned that a resident tested positive, and quit right there on the spot, hand in their keys and go like, nope. I had housekeepers do that. And what's funny is, I mean, maybe not funny, haha, but it's funny, odd, is I only had a couple of housekeepers do it. And this is only my experience and nobody else's, but they were all older men who said they weren't going to work with COVID. Nope, we're quitting if this is going to be. Younger men, no problem. Women, I didn't have any women quit on us, because of COVID. It's a weird thing, but I was surprised at how many people were like, I'm not working around this, as if we haven't been working around C. diff, VRE, HIV, hepatitis,
right.
COVID, all kinds of things. So
it was such a emotionally charged topic, right? And so you definitely saw some interesting decisions. You also saw some incredible heroes come out of that, right?
No question.
People willing to jump into, COVID units and work endlessly, right? And, if you've got full PP on for a while, it is so uncomfortable and it's so physically it's a burdensome. And there was nurses and caregivers doing that day after day, month after month, and just giving it their all. And that was hands down one of the most humbling experiences I've ever had, is going to campuses and seeing that firsthand and seeing what our caregivers are doing to make sure that we're taking care, they were taking care of residents. Like, just hands down, such a humbling experience to see and be a part of. So, but to your point, right? Those kind of environments, right? You see the highest highs and you unfortunately see some of the lowest lows. And it was kind of that was definitely an interesting time, but really fortunate to get to see some of those really incredible moments of people just going far above and beyond to do what was needed during COVID.
I had this guy, Mike, working for me, and he had a couple of young people working for him, and they were really nervous about the COVID unit.
Mm-hmm.
And he was the manager, and he's like, don't worry, I'll clean the COVID unit. Don't worry.
Yeah.
Then every day he would suit up to clean as the manager every day, just didn't make a big deal about it. They were nervous about it. He wasn't going to beat him up over. He's like, no big deal. Go do this. I'll clean the unit. Like, what a great guy. Like, to your point, you know,
and that just, those stories percolate through organizations, right? That servant leadership percolates through the organization and really kind of, and then you get one other person say, hey, I remember what that was like, and I remember what I felt and when I saw that, and then they start doing that, and then they create 2 others or 3 others that then they know that's kind of the expectation, and then you get this really cool cycle that starts happening, right, where everybody's jumping in, and there's never a, no, that's not my job, I'm not doing that. And so that's some really neat stuff to see happen.
Yeah. So what's it looking like for you guys now that you are, now that we're well out of COVID? What's it like for you in Kentucky, by the way? Here in New York, I live just outside of the city, but there's not many places where you have to wear a mask still. I do have a VA appointment and with the VA Medical Center, and I was told that I have to have a COVID test before I can go to see my doctor. So VA still holding on to it.
Yeah.
So that's interesting.
I mean, obviously in our campuses, right, we're fully masked in our campuses, and we're following CDC protocols in our campuses, and that's obviously, as we start to see some COVID, or if we're seeing any COVID, we've got protocols in place for that. From a general public perspective, right, going out to supermarkets or going outside, I mean, we're kind of, they're not really seeing a lot of masks, and we're in full gather mode, kind of here in the Midwest, and so we're all gearing up to really enjoy the summer. From a company's perspective, right, operationally, we've really kind of we've recovered from a census perspective, and we're in a really good spot from that perspective, which we're really happy to be able to be there. For us right now, it's really about how do we continue to move forward with some of the implementations and some of the processes we had from COVID and around our SHIELD program, and how do we firm
the internet.
I know the internet's not being my friend today. Really for us is how do we continue to look at, hey, if we know we have this variation, how do we continue to reduce that variation of a possibility of infection or an outbreak at a campus? And for us, that's one of the things we're constantly looking at and saying, hey, is there a new technology out there that we could implement that could help with that? And that's something that we're heavily invested in. We're constantly scrubbing the market to find new things. You were mentioning earlier, right? Everything was thrown at us during COVID, right? You had all these different new technologies and processes and chemicals, and it was you had to open up your textbooks, right? I mean, you really had to get down nitty gritty. And I remember, I probably fielded a couple hundred product demonstrations, right? Because you couldn't afford to let something go by and not look at it.
Yeah.
And so that was really, by the end of it, I got very smart on some processes that I was never exposed to before, but it was like, you gotta just dig down and put your nose in the book and read and really understand at a biological level, at a chemistry level, at a physics level. You got to really understand how some of these processes work and be able to call, either be able to say thumbs up or thumbs down. And it takes a lot more work than just kind of taking somebody's word for it and just assuming that's going to work out for you.
Yeah, I'll admit that I'm probably the worst at being pitched to. I don't know. I mean, I just don't see it. There's a lot of times, I've been pitched over. I remember the first time somebody came in to try to sell us on microfiber. I could not have been more against it. I thought, what a waste of time. It's basing the whole microfiber. This is back, this was 15 years ago or so, maybe even a little longer than that, when they were just coming out with a mop for every room. And that's what the microfiber pitch was. You can have a mop for every room. And I remember just sitting there and going, so you're saying that right now we're using chemical that cleans every room, but it does, you know what I mean? Like, what are you talking about? The disinfectant doesn't work room to room? Like, how's that possible? Does disinfectant go away? And if it does, how quickly? Because we're changing our mop water every 3 to 4 rooms. So that's maybe every 30 minutes, 35, 40 minutes, maybe an hour. You're saying the disinfectant is no longer active after an hour? I mean, bleach and water has a 1 in 10 ratio that lasts 24 hours are effective, right? So what are you talking about? Like, you know what I mean? Like, I'm not an easy sell on stuff like that. I'm not an easy
totally agree, right? I mean, there's been a number of conversations that I've had with vendors that are pitching something that I'm already pretty familiar with, and we start to get down in the nitty gritty, right? And it's like, oh, we were not prepared to answer those questions today, and that's fine, right? You know, we kind of take the approach of like, look, we're going to listen to everybody that comes across, and we're going to challenge it and really, you know, ask the questions. And if we think there's value in something, we're gonna try it, and we're gonna really see, can we validate, right, what the claim is and what's out there, and if we can validate it, and kind of going back to what we were talking about before, right? There's just not a body of knowledge out there that says there's not an ASHRAE, right, for environmental cleaning, and so there's just a lot of, you know, there's kind of, you know, I'm not gonna say. There's just a lot of, you know, kind of tribal knowledge out there of, hey, we think this works or that works. And so, you know, I can't tell you how many different medical journal reports and studies that I ended up reading and really starting to understand the data perspective behind medical journals, and really starting to kind of break those down and say, okay, what does this really mean? How does this really get applied? Okay, this works in a hospital. Can we make it work in our environment? Hey, we really think that we can make this work in our environment. Okay, how do we recreate that without having a plan? And even from some of the vendors we were working with, they're like, you know, we've never really had this technology used in a senior care. So, you know, you're kind of taking some things and you're really kind of stretching it out there. But you know, our approach was always, if the medical research is pointing in that direction, and they're saying that, and they've already done the back work and the leg work to say, hey, this is the right direction to go, we can use that. And you know, our expertise as operators, you know, let's utilize that to the best of our advantage, knowing that benefit has already been established and well documented. And so that's kind of been our approach as we kind of go after these things, and really just trying to be able to connect the dots between, all right, here's the product, where's the research that shows that this product works, and be able to connect those two dots and say, okay, now we just got to figure out how to operationalize it. And we're super fortunate. We've got great operators in the field that can do that consistently, and have been able to figure that out for us. So that's been really exciting for us.
Yeah, no, that is key. It's important to, you know, as we keep saying throughout this whole conversation, is how much information is trapped in other people's heads. It's so important to get so many people engaged and, you know, just go like, what are your thoughts and what are your experiences and what do you think? And because there's so many things. Like, here's something I didn't really even understand until it was like somebody had to sit down and explain it to me. Disinfectants don't have penetration ability. I did not understand that. I'm like, well, I don't even know what that means. And it just simply means that if you spray bleach and water over blood, the blood's still going to be affected. The surface might be clean, but it has no ability to kill everything, right? Just the surface. It doesn't have penetration. It's those kinds of things. You're like, there's a lot to this, isn't there? There's a lot more than PCI.
And it's funny you say it, because like then to your point, right? That penetration process is highly affected by the surface that you're working with, right? And that surface can be very different than, and can again sometimes be counterintuitive, because sometimes you get these very small micropores in a laminate or something where you've got to make way more physical abrasion on that surface to be able to remove that before you can really disinfect that surface, versus maybe a natural fiber or a natural, you know, where the pores are going to be a little bit larger and you're able to scratch. So like there's a lot of variability in there that, you know, for an operator, you really got to understand what you're working with, why you're working, how you're working, what you're doing to be able to get the results you're looking for. And so that's something that, you know, has been eye-opening for us through our ATP program is, hey, we really, you know, that surface, we're just not, you know, we can do better on that surface, what's going on there, and adding that physical abrasion it was nine times out of 10 was the solution to it. It wasn't a chemical issue; it was a physical abrasion issue, right? And so how do we
physical abrasion issue?
Yeah, right. And then how do we train our health? How do we train our housekeepers that here's enough physical abrasion that you need to be applying to that nurse call, to that nurse call button to be able to get that clean and to get it effectively clean.
It's funny you bring up laminate, because I know we're running against the clock here, but it's super fun talking about this stuff. It's funny you bring up laminate, because another thing that was a big misnomer is contact time, how long a solution needs to stay on a surface. And everybody immediately, chemical companies were all over the place prior to 2020. Everybody was like, 30 seconds, 60 seconds, 2 minutes, 3 minutes. And then as soon as COVID hit, everybody said 10 minutes, dwell time, 10 minutes, across the board. And so I started seeing an awful lot of ruined furniture. Everything was getting ruined, like bubble, like the surface of the
yep.
And I was like, okay, there's something going on here. And so there was two things I discovered. Number one, and I'm not saying that this is the thing, but the FDA, it turns out, does not allow any chemical to have any kill ratio if it takes longer than 10-minute dwell time. That's interesting. So all chemical companies just went to the max time they're allowed.
Sure.
10 minutes. But here's the problem with that. There's two different types of laminate. There's low temp laminate, which is, low temperature, meaning it's not very hard. It's very porous. And the reason we do low temp is because it's very inexpensive. And then there's high temp laminate. High temp laminate is very hard, not porous at all, very expensive. And so what are we finding in many senior care homes? Low temp laminate. So you have low temp laminate, highly porous, very inexpensively made, with 10 minutes of water on it. And no wonder they're just crumbling.
Right.
You can see in particle wood come up underneath that, because that, on one hand, you have the chemical company going, just to be safe, we're going to take the max contact time of 10 minutes. And on the other hand, when you're buying 300 overbed tables, for a 150 bed building,
and to that point, right? I mean, how often, and that's one thing that for us out of COVID that we've started having a conversation around is, typically it's the facilities guys, it's the plant ops guys that are giving feedback to your development guys or your construction teams on material selection. And now we've included our environmental teams in how do we get that feedback filtered in from a product selection, right? And it seems so simple, but sometimes that's a long transition time. And how do you make sure you're selecting the right things in the short term that you're making that transition? And so that's, again, right, kind of going back to the conversation we had before, is you've got all these different competing requirements, but
I'll finish your sentence for you. How do you make it all work together, right? Like, how do you keep everything in check, in line? I know.
Yeah. Super fun stuff.
It is fun
stuff. It keeps me busy. That's for sure.
Yeah. I like it. Thank you so much for coming on. This has been a lot of fun. I've really enjoyed it.
This has been a lot of fun. Yeah.
Shop. Super fun.
Absolutely. It's been a lot of fun, and glad to be on. And we're always excited to be on with you if in a couple of years, if we have some new things to talk about.
Oh, absolutely. Well, let's talk about Trilogy real quick, because
sure.
You guys are growing like crazy out there in the Midwest. So what kind of opportunities are there? Are you guys hiring right now? How does somebody apply?
Yeah, good question. So trilogyjobs.com is the best place to go. And that will have all of our openings throughout the Midwest. And so we're building a number of campuses this year here in Kentucky, Ohio, and Michigan. And we're kind of, we're throughout all those states. And so there's a facility that's available or close to access in just about all those states. We're our bread and butter, and really what we feel is our secret to success is really having that culture set at that campus level, where, servant leadership is really at the top of that, and displaying that and living by that, and believing that our employees are really the key to our success. And if we take great care of our employees, we know that they're going to take great care of our residents. And so that's really our biggest focus. So yeah, absolutely.
That's great. So trilogyjobs.com. That's right. That's the best place to go. Yeah.
That's
for all levels
right.
too. For all levels.
All levels.
Great.
All levels. Here at the home office, at our campus levels, our support teams. Best place to go. We're 125 plus campuses right now.
Oh, wow.
And so we're going to be continuing to grow. So we're going to be at about 130 here in the next year. And so we're super excited about that.
Yeah. Good for you. Good for you. That's really awesome. That's awesome. So trilogyjobs.com. His name is Parker Lacy, VP of Facilities. Is that right? VP of Facilities?
That's right. That's actually right.
Off of memory.
I support. I typically don't introduce myself that way. I support our facilities team here from the home office. So if they need guidance or support from the home office, I'm the guy to talk to at our home office. So I'm just happy to support them, and always humbling to see all the work that they do out in the field.
Yeah, awesome. Well, I really, again, appreciate you taking the time to be with us today and talking shop, because it's the funnest thing in the entire universe. And dare I say, I bet somebody heard this and they were like, maybe we should reconsider what we're doing. Maybe we should be talking more about it. Always have the conversation, always be open to learning new things, especially when it comes to environmental services, because there's so much to know and it's changing all the time. But that's it for the Housekeepers podcast, which is going to be called Talking Dirty with Ralph Peterson. I'm Ralph Peterson. He